Good afternoon, everyone. I work as a registered nurse, and I was trained with Western Sydney University 10 years ago. These are the forms I used when I was a trained nurse, and these are the ones we're used in the hospital. However, nowadays, everything in the hospital is electronic, but our nursing students are still trained with this paperwork. So they're excellent students, they work very hard, they know their form well, but when they're working in the hospital, they don't know how to use the electronic system. I wonder there's a solution to help us solve the problem.
So here's what we think the problem is. It's predominantly paper-based, which means it's prone to human error. Additionally, the main issue we're trying to highlight today is multiple files per patient being available to nursing students. This unnecessary duplication of data is difficult to manage, time-consuming, and needless to say, causes burnouts during CPUs or clinical practice units. Adding on to that, we have unstructured data, both qualitative and quantitative, is hard to collate, analyze, and interpret.
So with the simulation lab, we have over 200 students across 4 different campuses trying to access the same patient file at the same time. Will that be accommodated?
Yeah, absolutely. So here's what we think our solution will address. So we have a master patient record, which allows effective duplication of the original copies and allows multiple students in real time simultaneously to be able to access records without overwriting the original copy. So the cloned copy will be able to allow students to individually practice interpreting vital results. Adding on to that, academic staff are able to simultaneously, in real time, monitor and view students' progress and statuses as either draft, in progress, or submitted. And finally, and most importantly, we're incorporating evidence-based practice, which means that we'll be able to effectively bridge the gap between theoretical and practical nursing skills.
So we have a registered nurse in our team. It was hard to impress her. No AI, immersive technology, or machine learning impressed her. What we have here is a basic foundation app, which is readily available, easily customizable, cost-effective, and can be done in a shorter time period. So student logs into their cloud application using their unique student ID. Once they log in, they're going to land on this home page where they're going to see 2 tiles, master patient file and their practice file. So the master patient file is access and permission is only granted to the advisors, so they can only clone and use it for their practice. Simultaneously, this is how teachers can monitor and track students' progress. So they can make any changes to the master file and see students' status. And yeah, the application is accessible on the go, and data can be viewed anywhere. So this is a detailed record view. Basically, everything is viewed in rows and columns. So we have a priority, say something's high, and there's going to be alerts. And yeah, a foundational application which can be powered by tomorrow's technology and easy to onboard clinicians.
So the early warning function will be implemented within the app. So the single chart will be implemented by clicking into the observation chart. Anything falls into the yellow area or the red area will be giving a warning of clinical review or rapid response. And to help the students, we have a referral button to show the policy and procedures to deal with clinical response and rapid response. So call for action. Our solution prioritizes data security and privacy. It's easy and quick to implement. It allows multiple device access by multiple students at different locations. It's a reliable foundation for future technology. So join us to bridge the gap between nursing education and nursing practice.